Hi, my name is Mike Fogarty, and I am the founder and inventor of AccuBreath, a high-tech ventilation support and monitoring system for procedural sedation. I'm a PhD student in bioengineering here at the University of Utah, and AccuBreath ventilator has been the subject of my research over the past 6 years. Drug-induced respiratory depression and airway obstruction is considered the primary cause of morbidity associated with sedation. This diagram shows how sedatives can cause an airway to collapse and cause apnea. There are 42 million adults in the US who have mild to severe sleep apnea, and 80% of them don't even know that they have it. So when they go in for a routine colonoscopy and are sedated, they may stop breathing multiple times during the procedure. I have personally collected clinical data that shows that the average patient stops breathing 7 to 10 times during a colonoscopy. This is because the current standard of care is to simply provide oxygen through a nasal cannula or loose-fitting mask. Oxygen is provided this way does little to no good if the patient isn't breathing. And currently nothing is done to detect or prevent obstructive apnea during these procedures. So we have addressed this clinical need by developing the AccuBreath ventilator. All the nurse has to do is strap on the universal fit mask and turn it on. AccuBreath will provide a safe level of CPAP to the patient and accurately monitor respiration. At a glance, the nurse can tell exactly how much their patient is breathing via the simple, easy to read display. And that small amount of CPAP physically holds the patient's airway open so the patient can continue to breathe on their own. We have clinical data that shows that CPAP almost completely eliminates apnea from these procedures, and AccuBreath's patent-pending features were developed to solve actual clinical needs, and the solutions were informed by clinicians themselves. It's a high-tech, portable ventilator that will cost less than just $200 to produce. This is a direct contrast to the ventilators used by respiratory therapists that are large, bulky, and cost thousands of dollars. AccuBreath increases safety for the patient while also lowering costs for the facility. In 2015, there were more than 35 million endoscopic procedures in the US. We plan on significant early market penetration by giving the ventilator away for free when a contract for disposables is executed. A contract with 1,000 disposable units and the free ventilator will result in an estimated 89% gross margin. Additionally, the $30 price point for the disposables is even less than other ventilators on the market and still allows facilities to lower their costs per procedure. Since ventilators are not currently being used during procedural sedation, this is a new, unpenetrated market that is worth more than $1 billion annually. Thank you.